situation of COVID-19 in India and also discuss the concerns, the global concerns from around the world on COVID-19. I think they've started recording now, so I'll just start again. Hello and welcome to this very special Facebook Live session on COVID-19. I am your host, Dr. Karan Thakur, and today we'll be discussing the subject in greater detail, an issue that has become an issue of global concern across, not just in India, but across the world with the emergence of rising cases of COVID-19, the threat of new variants, and a general sense of panic that has set in. And no better person to talk about all of these issues than Dr. Kantroo, Senior Consultant Respiratory Medicine and Critical Care at Indraprastha Apollo Hospitals. Dr. Vinny, welcome to this session.
Hello, everyone, and thank you, Karan, for calling me here.
So it's so good to have you back, and it's always good to discuss issues with you. But unfortunately, today we are discussing an issue which has become really front and center once again, and that's the COVID-19 situation. I'd like to take your time and basically discuss the situation first in India on COVID, then what is happening across the world, especially in China, and then basically look at what is what are the symptoms, what are the types of variants that we're seeing, and then advice, good advice as is expected from you on masking, on boosters, on travel, and other such things. So let me start immediately on the most important issue, which is, Dr. Vinny, what is the current situation of COVID in India, even prior to all of this news coming out from China?
Right. So, as rightly pointed out by you, whenever there is some kind of New Year happening or any kind of celebration season or festival season, unfortunately, we here and there we get some kind of unfortunate news currently from China with increased number of cases. They have a lot of cases right now. What is happening in India is an important question. If we look at the number of cases, the weekly number of cases at present has been less than 200. Even today, if we hear about the number of cases which have been there, 190 odd cases weekly, which is very, very less. The recovery rate still is 98.8%, which is a good recovery rate. So in terms of COVID situation, yes, we are at a very kind of a better situation as compared to the whole world, because even European countries and USA is seeing surge in terms of the winter viral infections, which always happens in the winter season because of a very number of reasons which we are already aware of. So India at the moment is very good. China is really, really bad. There is news coming in from there, which I recently heard. From China, we don't have very open kind of a news which comes in, because we always find it on their part. They try to cover up their part of the story, and they don't contribute in terms of COVID situation. So the Prime Minister there has put in a curb on all the media, coverage which is happening, which I heard on the radio news today while coming to the hospital. There are, many number of cases which are happening, and the lockdown has just opened up 20 days ago there. But the day-to-day number of cases is going on at such a high pace that every day they are seeing about 80 to 90,000 cases every day. So the sheer number is so much, it is definitely going to exhaust their systems and healthcare professionals, because they have to see so many cases at once. I've heard they're not having enough supply of even paracetamol over there. But of course, this is all speculation until they give something officially. We are not aware of it, but definitely China's situation is bad at the moment. And that is primarily due to very number of reasons. They are opening up completely after quite some time. Their vaccination has happened about 2 years back, which we all know. And the elderly population, the most populous country in the world. And we know that they have so many elderly people, so much of population which is vulnerable towards COVID, because they didn't suffer the COVID waves which the other part of the world has seen at large. So definitely a bad situation in China.
Right. So thank you for giving that perspective, because it's very important for our viewers to know that the situation that has emerged in China is not out of the blue. Actually, there are those reasons that Dr. Vinny pointed out too, that they've actually been in lockdown for the past 2 years. Vaccination rates have been poor, especially in the elderly. And now once they're opening up, they are seeing the logical number of cases, and that's tragic, but then that's the way it is. I'd like to draw your attention, Dr. Vinny, to your practice, just so that viewers get a sense of perspective. In the past 3-4 months, people walking into your clinic, how many of them are you seeing with COVID?
Right. We do see a lot of upper respiratory infections coming and walking into the clinic. But if I see 10 patients in one go in my clinic, I would be suspecting COVID only in one of them. And if we think that if I'm sending a COVID RT-PCR report, the chances of coming in positive would be 50% only. So very less number of cases we are suspecting at the moment. We are seeing more number of seasonal influenza cases, not even H1N1, which was the current strain, which is in circulation. We are seeing influenza A cases rather than H1N1 strain in particular. This may be because we make it sure that we get our population, which is mostly the respiratory comorbidities, vaccinated against the influenza virus. So a lot of influenza coming in. Respiratory syncytial virus is another one, which is very, very common in children, where from the adults also get the infection, because children have also seen their schools after a long gap of 2 years, and they are being exposed to many number of viruses at one go. The third part of the population which is coming in is the wheezy bronchitis, which is due to the double whammy of winter, cold air, as well as the difficult levels of air pollution which we are suffering at the moment. So COVID, very less. Even if I send one RT-PCR out of 10 suspecting this kind of infection in one person, 50% chances that RT-PCR is going to come back positive to me.
Right. So that's quite instructive, because you're only talking about 10% of the people that are coming through that may have COVID, and even when you are sending samples, and this is previously, only about 50% are turning positive. So that's good news. So I just like to dwell on that before I go on to the variants question, which is the government is right. I mean, they're doing their preparation just in case something happens, and I think that's important. But preparation should not be taken as an impending crisis, right? I mean, what is your message to viewers who are looking at government action and therefore are drawing out the conclusion that another crisis is about to happen?
Definitely, we have seen a lot of forwards happening again on social media, WhatsApp, Twitter, that we are going to see a surge again. There is another wave of COVID which is coming in. There are new variants in circulation. But I would like to explain it to everyone that this is the normal exercise of the government as well as the healthcare institutions to go deeper into the kind of surveillance which is needed after the pandemics also. So the tail-ending pandemic needs to be, surveyed in a way that we get the situation on ground and we know what is happening with the variants which are coming in and day out. We need to send an appropriate kind of information to the government, which they process at their centers, with so many of our epidemiologists doing great job during the COVID and the post-COVID surge and waves, which should be commended by everybody. So this is a part of surveillance. Don't take it as any kind of alarm that there are a lot of meetings happening at the center as well as at the state level. This is a part of normal exercise. As and when we see surges happening in the other parts of the world, we have to keep our guards very, very high against any kind of new surge which may happen, and look back at our vaccination rates and think of boosters and also tweaking in the newer kinds of mutations which might be required for our existing vaccinations, which I'm really very heartened to tell that we have a very good basket of vaccines available right here in our country.
Yes, absolutely. And while we get into the vaccines part, I'd just like to pick out on what you said on social media. Yes, everybody's getting flooded with these messages, and there's an alphabet soup out there now: BF.7, XBB, various other things. For our viewers, could you just break this down? What is this whole talk about XBB, about BF.7, Omicron, and how does this actually fit into the COVID situation?
See, Karan, this is becoming very, very difficult for us as healthcare professionals also to remember so many of variants. They have so many of codes, and it's very, very difficult to remember all of them. But what we know of current situation is that there are reports of INSA-CoG, which is normal service that happens at our center. We send our data for the genomic analysis, and the government then takes the data from different states and they assemble this data, they analyze it and come out with their findings. That is the INSA-CoG, which is the consortium which is looking after these variants which are coming in from various parts of the world. So variants of concern, variants of interest are given special importance according to the level of red alert, which we should be looking at them considering their virulence and the infectivity which is present inside of these viruses. So the third wave, which was in January 2022, was mostly caused by BA.1 and BA.2 particularly in India. These were the variants which were seen at that point of time. After that, in the summer of 2022, which was between the month of May and June, we saw a surge of BA.4 and BA.5, which were first found in South Africa, I think. And I am aware that it is not appropriate to name the countries wherein these variants have been found, because it's very, very difficult to pinpoint where exactly a variant has taken birth or arisen. So it's very difficult to follow these. But BA.4 and BA.5 was the one which was in circulation in summer of 2022, followed by these mutations, which is XBB, XBB1, BQ1, and now we are seeing the newer one, which is the BF.7. These necessarily are all the sub-variants or the sub-lineages of BA.5 and some of them BA.4. So if we say that when were these variants found in India, are we already exposed to them? What is happening at the ground level? Reports are there that we have seen BF.7 first in West Bengal, and it was first detected in July when the data went in from the state of West Bengal. On the other hand, XBB and XBB1 constitutes about 35% of the samples which have been tested in Mumbai. There are other reports which are coming in which say that the current dominant all over the world is XBB, very, very rapidly replacing the other variants. In USA, for example, about 60% of the samples only last week have been seen to be causing due to the XBB variant. So in India, it varies between 35 to 65, but yes, rapidly replacing all other variants. Now, China surge is being touted to be happening due to BF.7, but I want to reiterate this fact that these are all a part of Omicron virus, which we have seen a surge back then in January 2022. We are aware that our population is very well vaccinated against COVID-19, including some of them who have got their third doses as well. And the second thing is hybrid immunity, which means that they have got vaccination as well as the infection which happened in these 2 years, somewhere in the Alpha or the Delta or the Omicron wave. The hybrid immunity is considered to be the best. Our population, especially the younger population, is not very well susceptible to these newer variants because we have already suffered our infections. So that is a contrast with the China which is being seen, because Chinese population was under a zero lockdown and zero COVID policy, wherein they are not exposed to the virus as much as we are and as much as the other part of the world is. So we are at a better situation especially, but yes, caution needs to be undertaken, because we have seen even with Omicron, though the number of severe cases is less, but long COVID could be a problem there. On the other hand, some clotting mechanisms happening in the body with the patients who have comorbidities could be a problem. So always caution is necessary.
Right. So, I mean, obviously, you don't want to get this because it can cause all the problems that Dr. Vinny just pointed out to. But if you do get it, so whether it is one of these variants, what are the typical symptoms that one should look out for?
Well, if you ask me what are the symptoms of various variants, I would say the denominator of all the COVID infections has been the same. This is an upper respiratory infection primarily, more so with the newer variants, especially Omicron. Omicron, we have seen practically doesn't affect the lower respiratory system, which means the system which is downside of your larynx. Till the larynx, we call it upper respiratory tract. So upper respiratory means involvement of your nose, your throat, and your sinuses. So obviously the symptoms which would be there would be in the form of sore throat, coughing, nasal congestion, runny nose, malaise, fever, which is obviously seen with any kind of viral infection. Lower respiratory infection, which means the involvement of your lungs, your breathing tubes, as well as your breathing parenchyma, which causes the oxygenation of blood inside of your body, is very, very less. We haven't seen many number of pneumonia cases coming to us with the Omicron surge. On the other hand, we have seen clotting mechanisms happening during the Omicron surge also with in patients with comorbidities. So if anybody is having any kind of comorbidities, chronic illnesses, more age, elderly population, especially not vaccinated, even with 2 doses of vaccine, then I'm going to give you, a matter of a great caution that you should be at once going and getting your COVID vaccinations done to prevent yourself from any kind of a stroke happening or any kind of cardiac problems happening, which could be in the form of a heart attack, or on the other hand, a lung attack wherein your vessels of the lung could be getting clogged with any kind of the clots which are formed inside our deep veins.
Right. So to underline your message, in most cases, it will be like flu-like symptoms, like you've said, will not involve the lower respiratory tract. But if you do have any comorbidities, if you are a diabetic, hypertensive, or other comorbidities, then you should pay a lot of attention to it because of some of the issues that can happen, as Dr. Vinny mentioned. So Dr. Vinny, if you are diagnosed with COVID, what is the management strategy? Has it changed or is it pretty much the same?
It is pretty much very, very similar, Karan. We have seen that the COVID can be divided into 3 parts wherein the symptoms are concerned, wherein we see that patients can get mild symptoms, they could be getting moderate symptoms, as well as they could be getting severe or the critical COVID, wherein a patient might need intensive care, which is very, very, very bad, of course. But with Omicron, that part of the COVID, luckily we haven't seen, especially after the 2 doses of vaccinations have been given. Now, what needs to be done if you have COVID? First of all, please stop panicking. There is no need to panic. We have practically seen those people who get very panicky, who have mental health issues related to COVID, that I may die, something might happen to me, I have so many things on my mind to do, will I be able to complete them, will I live longer? So if you are relaxed, we have seen that our medicines working very well. So I always tell my patients to be, very, very happy and in a positive frame of mind. If you have a positive frame of mind, if you have that will to get better, there is nothing in the world which is going to stop you from getting better. So first of all, please stop panicking and isolate yourselves at home. It is going to save yourself in terms of giving you adequate rest for your immunity to work against the virus, as well as preventing others from getting the infection per se. So please rest at home for 5 to 7 good days so that you are free of the symptoms and not capable of infecting any more people. Hydration is extremely important, as we have talked here that this is a virus which leads to a stimulation of the clotting mechanisms inside the body. So if your blood is very, very sluggish because of dehydration, the clotting mechanisms get an extra edge over the formation of clots inside the body. So keep yourself well hydrated. Take warm liquids. Warm liquids are absolutely essential during the COVID times. It is known to soothe your throat as well as your upper respiratory systems. In terms of symptomatic management, we always say that you have to take paracetamol if you have fever and malaise, which could be a simple tablet of paracetamol, which is 650 mg, which can be taken 4 times maximum in 24 hours, including a gap of 4 hours between 2 doses which you need to take. Decongestants are the medications which are given for upper respiratory symptoms. This could take away your cold, cough-like symptoms, your blocked nose, and also steam is also very, very helpful for patients who have upper respiratory symptoms. Adequate rest, as I reiterated, is very, very important in terms of giving your own natural immunity a boost. So immunity is known to act faster and the maximum during the sleep hours of a person. When you sleep adequately and you have a restful sleep, your immunity gets very, very better, and the immunity has an adequate chance to manifest itself in the good way. So I would advocate 8 to 10 hours of good sleep during the night, which has to be a restful sleep, as against 6 to 8 hours, which is normally seen with our lifestyles these days. These things are absolutely important. Apart from this, if you're suffering from any kind of alarm symptoms, which could be a chest pain, it could be unilateral swelling of any of your limbs inside the body, a unilateral weakness of any part of your body, which can be a harbinger of stroke, or any kind of breathlessness which is unusual, and any kind of non-retractable cough, you're getting cough which is not settling down and is interfering with your sleep, then please see your doctor at once. You might be the one who's needing extra amount of care. It is not necessarily going to be severe, but yes, you do need attention.
Right. So let's talk about preventive strategies now, and two come to mind and are most important: masking and vaccines. Let's touch upon masking first. A lot of people are now planning to travel or are traveling, and because of the news coming out, a lot of people are now asking patients whether to mask or not. So what is the advice on masking, and what type of masks should one use?
All right. If I ask you a question, Karan, how would you rate wearing a mask as against not wearing a mask in winter months of influenza and so many viruses around? I'm sure your answer would be yes, because we have seen practically that mask has helped a lot. Yes. We as healthcare professionals are the ones who see maximum number of COVID patients as well as any kind of viral infections. So when we used to come and work in those waves which were happening, at that point of time, there were maximum people who were affected, around us also. So when we used to be masked, adequately masked, which was well-fitting mask, I can say this with authority that we didn't suffer the kind of infection we were seeing around, because we were masked at that point of time. Of course, when the COVID came in first, which was in 2020, when everybody was very, very afraid, and cases were happening unknowingly also, we had asymptomatic people who were around you. So when we used to go home, we used to hear that yes, so and so person also got COVID positive report. So I remember people who were unmasked at that point of time did get infection as against the one who were masked, and these were all the people who were sitting in the same room. So we have actually seen practically mask has very, very good effect in terms of preventing this COVID infection, which can cause an infection from one infected person down to a 10 or 18 number of people which can be affected. We have seen this with respiratory viruses, especially the RNA viruses. As they go on mutating, their level of infectivity goes high as against their virulence, which means the less severe disease is caused, but obviously they become more infective. So mask is, yes, going to help you. There was a study which happened in the healthcare personnel, wherein we compared the N95 mask as against the simple surgical mask. So healthcare people were working with COVID positive patients between 8 to 10 hours a day, when they were wearing a surgical mask on one hand in one arm, and on the other arm they were wearing only N95 mask. So when these were compared, we saw that both these masks are very, very effective and equally effective in preventing COVID-19 infection. So my recommendation would be people, especially who have comorbidities, should be wearing masks at any cost in indoor environments where there is a closed room, there is many number of people are mixing up. We are seeing that due to festival season, due to holiday season, people are coming back from to India from so many countries to meet their family and friends. So we should be extra careful. If we are inside a closed room, we are elderly, we have certain comorbidities, then we have not had our vaccination, especially the third dose in terms of elderly people, we should be the ones who should be wearing masks. If you are in an open air party where it is a big lawn and there is circulation of air happening, yes, at that point in time, you can take away your mask and get along without it.
Right. So basically, masks are important and they're effective. So we should really use them to prevent COVID and other viruses and flu infections. Now let's come to vaccines, Dr. Vinny. We know that the booster dose has not been such a big success. Government figures indicate only 27% of the eligible population have taken the boosters. A, what is the importance of boosters? And B, some actually want to get the fourth dose also. What is your advice on vaccines as a whole and on these questions?
So most of the data which has come up for boosters has come from Israel and USA. So we have seen with the third dose, of course, that it did help in getting down the severe COVID which might happen if your immunity has waned off. This has been proven scientifically that your levels of immunity after 1 year, 6 months to 1 year, does go down in terms of immunity which is provided by the vaccinations. So third dose is definitely recommended, especially in people with comorbidities, those who are elderly, which means age more than 65, and people who are healthcare professionals who see a lot of COVID and other respiratory infections a lot. So these are the people who should essentially be getting their third dose done. And in addition, I would say people who have chronic ailments in terms of asthma, COPD, any cardiac illness, or renal problems, they might not be, the transplant situations wherein vaccination is absolutely essential for transplant patients, but they might, on the other hand, be having some kind of milder renal involvement, which could be due to diabetes or what we call as the diabetic kidney. So these people should also be getting their third dose, which has proven to be very, very good in terms of providing the immunity, which can work against all these variants, which we have seen in the past. Also, people who have had their transplants done, which could be liver transplant, or it could be bone marrow transplant, or on the other hand, it could be renal transplant. These patients do not mount adequate amount of immunity, even with 2 doses of vaccinations. So these are the people who should be absolutely necessarily getting their third dose. It is very, very important for them to get their third dose, because even a virus which is less virulent in terms of Omicron, which causes the infection, in people with transplant, unfortunately, it can cause problems sometimes. So also we did touch upon the topic of air travel, which I think I forgot to mention about. So air travel, at the moment, there is no need to stop the air travel altogether. If you have any infection, please stay home, even if it means that you are canceling your ticket or your money is not being refunded. Please don't put yourself and others into trouble by just boarding the flights. I have seen during my flights people coughing and coming back into the flight and sitting there without a mask. It is absolutely detrimental and is not a responsible citizen behavior. So please don't board the flight if you have upper respiratory symptoms or any kind of fever. Now, if it is a short haul flight, which means that you're going somewhere for 4 to 6 hours, you'll reach your destiny, please do not take off your mask while eating. You could just take away that food packet, and once you deboard the plane, you sit down somewhere in a corner where there are not many number of people, and you can eat your tiffin there. So absolutely essential. A person who's sick should not board the flight. Do not remove your mask if it is a short haul flight. If it is long haul flight, of course, we can't help it. But then also, please put back the mask again as quickly as possible.
Right. So we're just out of time, and I've got one question on the intranasal vaccines. A lot of news around that. What is your view on this vaccine, which is about to come into the market, hopefully soon?
Definitely a very good boon in terms of the way we give this kind of intranasal vaccine. Very heartening news. Our country has produced it. Bharat Biotech is the one which has manufactured this vaccine, an indigenous vaccine, a matter of pride for our country. There are certain advantages with this kind of vaccination, which means that there is no needle involvement in terms of giving the vaccination. Especially important for people who have fear of needles and they who always say that I'm not going to take vaccination because I'm afraid of the prick. This happens mostly in case of children, but at the moment, this vaccine has been approved for people who are more than 18 years of age. That should be kept in mind. The second advantage is the storage advantage, which we have to keep. The temperature has to be between 6 to 8 degrees C, which means that even if a place is non-accessible, there is not much of connectivity in that place, we can take this vaccination down to these areas also with our level of technology which has come up. Storage is very, very easy. The administration, on the other hand, is very, very simple. Just some drops of this vaccination inside your nose, which makes mass vaccination programs, especially in situations of pandemics, very, very easy, and you're able to cover a lot of population in less amount of time. These things, though they sound very simple, they are very, very good in terms of administration and policies which are related to reaching the population and reaching down to the grassroots level. So in terms of these advantages, it is very, very important. On the other hand, medically, if we see, there is mucosal immunity which happens with the local vaccination which is put inside of your nose, which is the portal of entry for your COVID virus. So if we give the vaccination right there at the portal of entry, the division of the virus might go down due to the IgA local immunity which is produced there. So the number of infective particles which are there in your nose can go down. So your infectivity levels might also come down. Of course, we have to see these kind of findings when we give this vaccine on a mass scale.
Right. So that's some good news coming out, and a vaccine that we should be proud of, just like all the other vaccines that we've produced. So Dr. Vinny, since we are out of time, what is your message to our viewers who are going to be ushering in the new year very soon around COVID and around the healthcare, around their health in general?
Right. So I wish everybody, including you, Karan, a very good, happy holiday season. Season's greetings, Merry Christmas, Happy New Year to all of you. My only message is please mask yourself up if you are going to be in a closed environment in a party during the new year. If you are able to avoid certain parties and not causing harm to yourself as well as to your fellow people, please do that. The parties are going to be there n number of times when we see future which is free of COVID, of course, with the level of immunization and the work our government and various medical institutions are doing in terms of COVID work. Please mask yourself up. If you have not taken your third dose, please go get your third dose done. And if there are certain people still haven't taken their vaccination against COVID, please go out at once and take your COVID vaccination. It is absolutely essential that we prevent the severe or the critical COVID, which the COVID virus, the dreaded virus, is capable of doing in terms of causing COVID-19 pneumonia.
Right.
Wish you all a very, very happy new year, and thank you for calling me here.
No, thanks for joining us. And as viewers would know, this is the reason why we get Dr. Vinny. She's explained so beautifully around the virus. Why is it a concern, but not a reason for panic? What to do about masking, how to behave responsibly and also to have fun responsibly. So thank you, Dr. Vinny. If you do want to get in touch with Dr. Vinny or want to understand more on the aspects that she's discussed, our contact information is on the ticker. Dr. Vinny is also very active on Twitter and has very good information out there periodically. So I would advise you to follow her there as well. But till the next time that we have another session and another specialist, do take care and stay safe. Thank you.
Thank you and bye-bye.